Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a Cortical Capacitor series or edition. This audio podcast as part of a MaxxaR Pathology. And this audio podcast as part of a Storm Robotics production. In this audio podcast, a little bit around a UK perspective, although the published works. The published works and sort of later in this audio podcast series there is a sort of a United States example of some works as well. Um, this in around this audio podcast, a little bit around a UK perspective as part of this works looking at electronic patient records, patient records, and multidisciplinary team meetings, MDT meetings, and where this works, where the works, where the published, where peer review published works from 2014 looks to answer: is it not time to integrate primary care for the better? So, in around the sort of UK perspective, although for most in the United Kingdom, the national in the United Kingdom, the National Health Service or NHS has been sort of the sort of open quote close quote the only sort of health service that is known and for people unknown and for a few people sort of historically, there was an example referred to as the sort of referred to as the Peckham experiment in the district of Peckham in London, is where it's still living still whereas it is still within sort of a living memory. The Peckham experiment was only known was known as the only health sort of center, but it offered health services vastly different from the NHS as it is today. The health center was a place where near neighbors could meet each other on neutral ground, and share sort of share sort of share sort of experiences and sort of perspectives, but also where the works published by the Pioneer Health Foundation in 2014 had highlighted sort of how the Peckham experiment, in the district of Peckham in London in the United Kingdom had 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 documented and reported sort of aspects around how the healthcare sort of center basis was a basis in around allowing and sort of encouraging sort of where different members of community could meet and sort of learn around different experiences. The main insight of the Peckham experiment was the guiding principle in the minds of founders, was that wherein the environment is is principal to good health, and by this the founders meant what is now or has been referred to as psychosocial environment or psychosocial environment, um, and where the terminology links has a link or linked to where being able to share ideas and sort of stories with people who were from other from other sort of from other sort of families or backgrounds, and living in the streets of the surrounding area around the health center, and where at the time was considered to be a sort of a vital for health and well-being. So as people shared stories, for example, networks were created, and through the exchange of stories, a great deal of shared learning took place. The health professionals, as the health professionals at the health center, were joining the conversations when invited to help individuals, families, and community groups to learn things that were not yet known, that were not yet known to them, such as how to access general and specialist medical services, how to pay certain fees in around healthcare services, how to encourage young people to be confident in around aspects, and to enjoy to learn around sort of the sort of learn around sort of entities and aspects that can prompt sort of more positive sort of mindsets and behavior. The Peckham experiment continued for some time to feature in BBC radio programs, radio programs, and the building that was used is now had been a sort of a listed building in London, in the United Kingdom, and the 16 or more boxes of documents and research materials had been part of the archives, in the Wellcome Foundation in the United Kingdom. The idea that the psychosocial environment needs attention is or had been important for health and well-being, is now the subject of the has been sort of a subject of debate daily through various media streams, and where people sort of meet. Original works around the Peckham experiment, have been documented by the Pioneer Health Foundation in around 2014, and there is now an increased understanding of how information, for example, around information communication and technology, or ICT, in addition to using social media. Social media can support the acquisition of knowledge and understanding for patients from varying conditions, around varying conditions, and this has been demonstrated through a number of investigations, user-friendly ICT and social media platforms can be important for knowledge and resource acquisition, integrating care. On contrast, it is important to appreciate that using information communication technology and the internet for knowledge acquisition does not apply to all, owing to complications, where there can be complications around, for example, health literacy, or around health literacy. That draws this audio podcast to a close. It's been an audio podcast as part of a Cortical Capacitor. This audio podcast has been a part of a MaxxaR Pathology, an audio podcast as part of a Storm Robotics production.